Well, there are now a record number of Americans hospitalized with COVID, more than 142,000 as of Sunday. That's according to new government data.
Amid this ongoing record surge in cases, there are still a lot of questions and a lot of confusion out there about testing.
UW Health Chief Quality Officer Dr. Jeff Pothof is here, as he is every Tuesday, to help answer some key questions. Welcome back, Doctor.
Hi, Dr. Pothof. Good to see you.
Yeah, good to see both of you.
All right, so let's talk about testing. When should you do it? Is rapid good? I mean, let's start at the beginning. Let's say you have no symptoms and you had an encounter with someone who is positive.
Yeah, so if you had no symptoms and you had a close encounter with someone who's positive, so you're worried you're going to convert and get COVID-19, the best way to know if that happened or not is to wait anywhere from 3 to 4 days. You don't want to get it right away. It'll be too soon. And because you have no symptoms at all, the best test to determine that would be a PCR test. It's likely that a rapid antigen test in that scenario would be negative, whereby the PCR, if you're starting to replicate virus, would likely be positive.
Okay, so that's good to know. You have to wait a couple of days before you get tested. It's too soon if you do it right away. How reliable are the rapid tests? And what happens, for example, if you get a rapid test that is negative and then a PCR test that is positive, or the other way around, or vice versa?
Right. So I think an important kind of rule of thumb for the rapid test is the rapid test is more reliable the more virus you have in your nasal pharynx, your nose, or your mouth. So what that means is that if you wake up tomorrow morning and you suddenly have a bit of a scratchy throat and you're wondering, boy, do I have COVID? Your viral loads may not be high enough yet to make that rapid test positive, whereby they might make a PCR test positive. Now, if you've had symptoms for 24 hours, maybe more than that, 36 hours, and you're like, you know what, maybe this is COVID, and then you do a rapid test, that rapid test is more likely to give you an accurate result at that point if you have those symptoms likely positive. So that's why we recommend if you have symptoms and that rapid test is negative, if you can find them, getting a PCR test is a better way to know if you're truly positive or not, because you may not have enough viral material to make that rapid positive.
Well, we've had some folks here take the PCR test and they've waited 4, 5, 6 days for results. There's so many tests out there. By then, you may not be contagious anymore.
Right, and I think that's important for folks who are having a difficult time getting a test. Right now, just about everyone that we're testing for symptoms of COVID have COVID. So if you have those symptoms, you can almost assume that you have the disease. You can start your isolation. And if you're completely asymptomatic on day 5, which is getting close to when some of these test results are coming back, you can try to find a rapid at that point to kind of confirm, am I still positive or not? Or you can put that mask on, tight-fitting mask, and as long as you can wear that the entire time that you're in public, i.e. no taking it off for food, no taking it off for drinks when you're around people, you could go that route rather than trying to find a test and wait for the result.
Are you still recommending that people who are feeling cold symptoms get tested? I think I just heard you say that everybody who thinks they have a cold is testing positive right now.
I think in a perfect world, if we had easy availability of tests, that's the best scenario because it gives us great data on what's the real prevalence of the disease in our community, and that helps us make decisions. But being practical and realizing that not very many people want to wait for hours to get a test done, if you can't find a test readily available, I think it's okay to isolate. And for the most part, you can get tested within, 2 to 3 days. That could still be helpful. I think that's probably the way to go right now.
And the Alliant Energy Center has lots of openings now that they've increased production out there. Let's talk about masks, cloth out.
Yeah, I think cloth masks at this point, they're falling on less favorable opinions just because it's really hard to know how well that cloth mask is going to filter. Is it going to be tight-fitting? And with Omicron so contagious, and surgical masks and N95s, K95s being available, I think it's the better part of valor to just go ahead and use those masks that we understand their performance better while we have this really contagious variant out there.
How long can you test positive for COVID-19?
So if we talk about PCR tests, it is not uncommon at all to test positive up to 90 days after your infection, just because those PCR tests are so good at finding just even one strand of that genetic material. For those rapid tests, anywhere from 10 to maybe 12 days out, you could still test positive, but there's plenty of people who won't test positive 5, 6, 7 days out on a rapid.
And no end in sight to this variant?
Yeah, where do you think we are right now?
You know, actually, Mark, I think we might be doing okay. So in South Africa, cases went up, came down pretty quick. We're starting to see that similar trend in the United Kingdom, a little bit in New York. So, you know, fingers crossed, maybe this goes through pretty quick and life starts to look a little bit more like normal before the end of winter.
Yeah, by the time it spiked and then fell in South Africa, it was only about 5 weeks. So that's very encouraging to see.
All right. Well, if you're not feeling well, stay home.
Absolutely.
All right, doctor. Good to see you again. We'll see you next week.
Thank you, Dr. Pothof. Always appreciate your time. Thank you so much.